Hi, I'm June Minchow here with Pal Valley Healthcare. I'm visiting today with Kindy Krei, who is a member of our public health team. I've got a few questions for her, and they may be equal to the questions that you have regarding our COVID-19 vaccine that you have heard has been out in our county now for the last 2 or 3 days. So Kindy, there are a lot of questions floating around about this COVID-19 vaccine.
Yes.
Perhaps you can help us answer some of them.
I can sure try.
So how is this vaccine being dispersed to everyone in the county?
So right now we are partnering with both Cody Regional Health and Powell Valley, and of course Public Health, and we are working together. We have daily meeting calls, and we are getting that vaccine from Cody Regional, who's housing it. They have the ultra cold storage, and we're picking it up from them and kind of distributing it at those 2 hospitals and amongst the community.
So is it just going to hospital providers right now? Is that correct?
Yes. So with this first dose, we got 975 doses. I'm sorry, with this first shipment, we received 975 doses of the Pfizer vaccine, which is to be used amongst a very specific group of people, and those people include hospital staff who are in direct patient care, folks like long-term care facilities, other high congregate settings. We've got public health in there, some first responders, folks like that, kind of the front lines.
I know that here at Powell Valley Healthcare, we are getting ready to start our vaccines on Friday.
Mm-hmm.
And they will start with emergency responders, and then it will go to our med-surg staff and those who are working closely with patients who may have COVID. What does it look like down the road? How soon do you think that we will have vaccines available for the general public?
So unfortunately, we don't know exactly when we're going to get those vaccines, but we are told that hopefully within the next couple of months. So right now the hospitals, the 2 separate hospitals in our county, are working hard to vaccinate the individuals that work for their districts,
Mm-hmm.
and then public health is trying to pick up the slack with kind of the rest of the folks that fall into those frontline
Sure.
workers. And as soon as we get through those folks, we'll get to move on to the next group of people. And
Is
so
there somewhere
really,
that people can go to look and see what that tiered process looks like, so they might have an idea of when their vaccine would be available?
Yes, there is. I want to say it's probably located on the State of Wyoming website. So that would be located under, it's called like Phase 1A distribution of vaccine. And so that's where we're at right now, is they call it 1A. Once we're done with 1A, we'll move into 1B, and then so on and so forth.
So we're getting the Pfizer vaccine right now. Have you gotten any word yet on the next one?
The Moderna, yes.
Moderna.
So we're still awaiting the EUA for the emergency use authorization for the Moderna vaccine, which we expect that to come through pretty quickly. They were estimating a week after the Pfizer, so that would
Sure.
put it any day now. And once that occurs, we're kind of expecting to receive weekly shipments between the Pfizer and the Moderna. It's important to remember that we can't interchange those vaccines. So if you get vaccinated with the Pfizer vaccine, your second vaccine needs to be with Pfizer as well.
Mm-hmm.
And if you start with the Moderna, you need to complete that with the Moderna.
Kindy, are these vaccines safe?
You know, they are as safe as any of they've gone through the same safety process as any of the other vaccines that we've received. Mm-hmm. The thing is right now is that they're new.
And it seems so fast.
Yes, and it was fast. It really was. But I think the important thing for people to understand is that most vaccines that go through this process take years and years and years for a variety of reasons. And mainly funding. Funding is a huge reason why it takes so long to get through this process of making a vaccine. When they made this particular vaccine, they decided to take a huge financial risk because they felt like it would be beneficial in the end if they didn't have to wait for one part of the process to be finished before they started another part. So they did a lot of the process at the same time, instead of doing one part, completing
and then having to wait
for funding, and then do another part, wait for funding and approval, and so on and so forth. So that is one of the huge reasons why it was so fast. But that doesn't change the fact that they still had to meet all of the requirements,
all of the safety standards.
None of that was sideswiped in the process of making this vaccine.
Okay. So getting the vaccine, can I still get COVID? I mean, is it going to give me COVID?
Well, it's not going to give you COVID because we're not working with a live vaccine here. So there's no possible way for it to actually give you COVID. Now, is any vaccine 100%? No. So do you still have a possibility of getting COVID after you have the vaccine? Yes. That's the same with any disease process and any vaccine that we give you. Nothing's 100%. But it's another one of those tools that we have in our toolbox to really greatly reduce the chances of getting this disease and of spreading this disease. And so absolutely not, you can't get COVID from the vaccine, but it's also not 100% either.
So am I going to get sick if I take it?
So anytime we give a vaccine, June, we are looking to provoke that immune response in your body. It doesn't matter what vaccine.
So you want me to respond to it?
We do. We want your body to recognize that it's that there's something foreign and to attack it and to build those. I call it an army, against whatever foreign invader has come into contact, has invaded your body. And so when that happens, we often see things like when our body is building that immune response, it's taking a lot of our energy to do that, and it's focusing on that sole thing. And sometimes we just don't feel 100%. We just kind of feel blah, like just maybe run down, tired, maybe a low-grade fever, maybe achy or chills, and that's one of the reasons, honestly, why there's such a misconception out there about the flu shot. And I know we're not talking flu, but
I get it.
But a lot of people feel like the flu shot actually gives them the flu because of the immune responses. And so when you have those symptoms, when your body recognizes that and it goes to work to build those antibodies, and you start feeling some of that stuff, it's easy to be confused. But in fact, that's what we want, because a good, strong immune response means that our body is preparing itself to be able to protect us from that antigen in the future if it ever were to invade our body again. So,
excellent.
Yeah.
So once I have this vaccine, I get to take this mask off and I can take my goggles off and I don't have to wear all this stuff, right?
Wouldn't that be great, June?
Yes.
Yes, I
Yes,
know.
it would.
I know it would be. Unfortunately, no. So we do need to continue our due diligence, and use all the tools in our toolbox that we have at our disposal. We need to wash our hands. We need to wear our masks and our goggles and our PPE if we're in the hospital setting. We need to try to all of those common sense things that we already know. Like if there's somebody over here that's sick, don't go hang out. Right.
Just to assure everybody,
yes.
Pal Valley Healthcare will be continuing to wear all of our appropriate PPE even after we have the vaccine.
Yeah.
And it's kind of a side note, we have noticed a decrease in people with the flu, people with colds, just people with general I don't feel good kind of things.
Yeah.
And I don't know that it's directly related to our mask wearing, but it certainly could be that we're not spreading
Well,
those kind of
absolutely.
germs.
I mean, I can say very confidently that I think it's because of all, the social distancing, the masks, the hand washing, all of that stuff, because that's how we don't share all
That's
of
how
our
we
germs.
transmit, usually.
Yeah, we are using all of these tools to keep from spreading our germs to each other, whatever germs, not just COVID germs. I mean, it's whatever germs, and that's why we're seeing a decreased amount of, we haven't, like you mentioned earlier, this area hasn't even really seen flu yet.
No.
Influenza coming in, and we're testing for it. We've got the state tests that go down through the state. They test
Sure.
for COVID, influenza A, influenza B, all in the same test. We're just not seeing it yet, and
No, we're
I
not.
really think I'm confident in saying that a big reason for that is because of all these measures that we're taking.
I know we've covered quite a bit
We have.
covered quite a lot of information.
You're very thorough, June.
Where can we get additional information without calling our private provider, without going directly to our doctor to ask them
Yeah.
when the vaccine's due for me? Where can we get that information without bothering them with it?
I would say the community's best bet is to really be paying attention to the local, Facebook pages. So I know Powell Valley has one, Cody Regional has one, Park County Public Health has one, and we are all going to put all the information out that we have when we have it. And so you're going to find them on those, you're going to find them on, as soon as we get word that we are onto the general population point of vaccinating, we're going to have a plan in place, and you're going to hear about that on those social media pages, on the radio, in the newspaper. So I would be looking in those directions.
Okay.
You can always call public health, but again, when we have news, we're going to put it out there for the whole community.
Thanks, Kindy, and thanks for meeting with us today just to help answer some of those questions. If you do have further questions, please do as Kindy asked and call Public Health. They will have some information for you. You can check Powell Valley Healthcare social media pages as well as our website, and we will update that information as soon as we have it. I hope we've been able to answer some of your questions today. Thanks for being with us.